Welcome to our Medicare training call that we do every single week, 7 p.m. Central Standard Time on Wednesdays. So you'll be able to visit us and join us every single week, Wednesday evening, 7 p.m. Central Standard Time. So we are going over a bunch of questions that we have all throughout the week. So a ton of stuff that all y'all already know is what I'm going to do is I will go into a screen share to start. And in the screen share over here, I want to walk everyone through the Medicare agent portal. So in the Medicare agent portal, you have your training section and you have your Medicare website overview. So it's very important that you watch all of these videos, right? And learn all of this stuff as to why we do it and everything along those lines. So for GTL, for example, that is a hospital indemnity plan. Okay, so you want to know how to use their e-application, and it gives you the explanation here. Carrier contact form, AHIP discount link, AHIP $50 discount, gives you the instructions, and here's the Zoom call link if you ever lose it. The intro to Medicare is the next section over here. It's the intro to training. Okay, intro to training, Medicare Basics 101, how do I get started? How you get paid, right? Which will be updated for 2023. So I'll do that towards the end of AEP, like all this stuff. There's a lot of videos to update. So Medicare Basics 101, that's going to give you your foundation there of what Medicare is, how it operates, the two different parts, right? How Medicare pays, how with Medicare, when you get into inpatient hospitalization, if you just have Part A and Part B, what they call original Medicare, and you don't have an Advantage plan or a supplement plan, other health insurance, you will be paying a total amount of about $10,000 to $15,000 month one from your out-of-pocket cost, right? So you watch the video, it gives you the breakdown. And then month 2 and 3, after the initial months, or the initial month itself, you'll be paying about $25,000 to $50,000. So you want to learn what that means. You're going to watch this video over here. How you get paid now, how you get paid in the future, the basic steps to selling Medicare, and the basic steps to sell is a button there. So just click all these buttons, make sure you have it. Part C explained, Part D explained. You don't know what a Medicare supplement is or how it pays. You don't know the difference between a Medicare supplement or a Medicare Advantage plan, right? Watch the video and see. I always say it all the time on all these calls. Hey, if you guys can afford a Medicare supplement, go with that, right? That's the best quality, right? It's a la carte though. It doesn't have prescription drugs. It doesn't have Part D inside of it, right? It doesn't have dental inside of it. It doesn't have vision inside of it. It doesn't have hearing, doesn't have over-the-counter items, right? There's no transportation inside of it. There's no silver sneakers for your gym. But that stuff is not inside of it, okay? It's a la carte. It covers anything that Medicare doesn't pay. They're all the same. They're standardized. There's nothing but different between any Medicare supplement. The only difference is the premium that you pay on a monthly basis. So that's it. That's the only difference in the Medicare plan itself. So as I go through this stuff, LIS/extra help, Medicare savings program. Let me see here. Keep scrolling down. We have our D-SNPs and C-SNPs, right? So a question that I get from people is, do you need to have Medicaid to have a C-SNP? And the answer I usually give people is, hey, did you pull up the summary of benefits and read it? Right? That's a very, very important thing. So a C-SNP, and if you're not watching the videos in the training and you don't know answers to a lot of these questions, that's fine, right? But just make sure that you're actually going through the training, right? Because you're doing a disservice to yourself by not going through the training itself, and you're never going to be the best agent, which in turn is going to put your client in the best situation if you're not well versed in Medicare. So one thing that I was talking with someone today is we were talking about, hey, for final expense leads, right? When I'm going out there and I have final expense leads, or I'm sitting down with final expense clients, I'm talking with the FE clients that I acquire. Can I also sell my final expense clients? Can I sell them Medicare? Yeah, of course you could sell them Medicare, right? You could sell your client any type of product that you like, right? It doesn't matter. You can market to your client non-life related products all day long. There's absolutely nothing wrong with that. And you're going to put your client in a great situation. You're going to do a great job. You're dealing with people's health insurance. So All you have to do is just make sure you're well versed in the stuff. And when you go through the training and you watch this stuff and you educate yourself on this stuff, what it does is it establishes you as an expert, right? So you don't want to be in front of a client and not know anything, right? You don't want to be asking questions that you should know the answer to, right? And it's okay to not know the answer to certain questions, but one question, hey, does someone need Medicaid to get a CSNAP? And I was asking, hey, what does CSNAP stand for? Chronic. Okay. So if it stands for chronic and it's a chronic special needs plan, did you read the summary of benefits? No, I didn't. Okay, great. So that's fine. So it'll tell you, you click on it. It says about this plan. You guys can't see it. Here you go. Here's a summary benefits for it. I just pulled it off Sunfire. It says about this plan. To join this plan, you must be entitled to Part A and Part B, or Part A and be enrolled in Part B and live within the plan service area. That's it. So that's all that it is. Here it is next. A CSNP is a chronic or disabling condition, special needs plan designed specifically to help people who have one or more of the following conditions: cardiovascular, heart, and diabetes. So, and I know we covered that on last call as well. So that's something that all that you need to do is you just need to pull up in here and just read the stuff about it. So you don't need to have Medicaid to be on a CSNP. That's why it's at the bottom over here all the time. It's going to be at the bottom when you're under the special needs section. So you see that. So you see D is dual, which is a ton of different ones. And then another thing I want y'all to pay attention to is the star ratings for different plans. So I'm seeing plans in my area that are not rated that well. And there's a special election period, just so you guys know, right? So I see it with WellCare primarily. Let's see these different ones. Oh, I'm in the wrong plan year. Let's go to 2023. So I see for WellCare specifically in this area over here that they have some low plan ratings. And that's not good, right? Because who does the plan ratings come from? It comes from the clients itself. Okay, so we can look at their different plans over here, right? And you'll see what the star rating is. Look at that, 2.5 out of 5 stars. 2.5 out of 5, 2.5 out of 5, 2.5 out of 5, 3.5 out of 5, and 2.5 out of 5. How many is that? 1, 2, 3, 4, 5, 6. 6 plans averaging less than 3 stars for all 6 plans that they have. That's not good, right? That is 2.5, in fact, is horrible. And why do we know it's terrible plan rating? We know it's a terrible plan rating because we get a special election period. And the special election period says if someone has 3 stars, is in a 3-star plan or less, you're allowed to change them outside of AEP. So now anytime I sit down with someone that has one of these 5 plans that's rated less than 3 stars, 3 stars or less during the year outside of AEP, right? So it's only another 5 weeks. I can now change them using that special election period. Okay. So it's like, oh, well, how do I find those SEPs? You just pull it up here, election period cheat sheet right on the website, and you read them. And then it's also in Sunfire. I'd recommend whenever you're, going through all this stuff. Right now, obviously, you're using AEP for your election periods, but in Sunfire, when you're clicking enroll for the client and you're bringing them through it, just screenshot the election periods and you'll see it there as well. Yeah, so just make sure you guys got all these tools over here, and then make sure you go into the last section, which is the sales training itself, scope appointment, T65 presentation, your case studies, all that different stuff. So that way, you know how to use this stuff, you know how to use Sunfire, you understand this stuff. And it's important for y'all to be doing that, because I want you guys to be very, very well versed. So what happens is when you're very well versed in the Medicare space, okay, and you're sitting down with the client, you're talking to them, it shortens the rapport building that you need to do, right? When it comes to transitioning to life insurance or talking to them about other products, right? You establish yourself as an expert quicker, and you shorten the rapport building, you shorten the trust factor, because you're an expert. You're talking about the stuff and you're very well educated in it because you took the time to read the literature. You took time to watch the videos, to pause them and take notes. And I think that's the big differentiator between someone that writes 200 apps during AEP and someone that writes 20, right? That's a huge difference between a lot of people as well. So take the time to really make an effort and be great at it. The health assessment is another thing. So just make sure that you're doing that. We did find out that now we could do United Healthcare through Sunfire, which is awesome. Another thing that I would like everyone to do is make sure that you are saving all of your enrollments. Once you enroll it, you go back to the successful cases, you click it, and then you can download the PDF for each one. So just make sure you're downloading it so you have that on file as well. Let's go into, so I'm going to go back to Sunfire here real quick, and we are going to go, so right here is part D, which is prescription drug plans. So one thing that I'm seeing a lot is people will walk into the house and they'll sit down with a client that has a Medicare supplement, and the client has certain health conditions. They had a heart attack last year or something like that. Okay, well, in that case, you can't, Medicare supplements are underwritten, okay, unless they turn 65, or in certain states they are not. So Connecticut, for example, they're not, and there's 3 other states that it's not underwritten in Medicare supplements. But majority of states, there's underwriting. Okay, so with the Medicare supplement, right, they're all identical. The only thing that changes is the amount that a client pays per month. And what determines that is the stability of the pool, how large the pool of people is, how large the people that are, the pool of the people are, and the amount of premiums going into it and the claims coming out of the pool, right? So for that, if you sit down with someone and you're like, oh, you just had a heart attack yesterday, you're not going to qualify to switch from one med sup to another. Okay. And then you go to my training in here and you watch the video on how you get paid, and you're looking at it and you're like, oh, for a prescription drug plan, I only make $40. Well, this person can maintain the premium payments for the med sup, right? And all that I could really sell them and help them on would be a prescription drug plan. Well, in that case, you want to do what's best interest of the client, but also you have time that you need to, because you have a lot of people to see in a 5-week remaining period of time, right? Like, you got to be moving quickly to help all these people that took time to fill out a card and send it in and request information and request help, right? So for a prescription drug plan, the compensation is not high at all, right? It's low, making $40, whatever it is, right? It's not a tremendous amount. So with that said, you put their drugs in, you look at it, you see if you can help them. If you can help them based on plan premium and their prescription drugs and save them some money, then awesome. Then do that, expedite the sale, and get to the next person. Because if you can't help with their med sup and they can maintain their premium payments for a med sup, it's different if someone's like, hey, this is $350 a month and I just simply can't afford it. Okay, well, med sup is the Cadillac. It's the best thing that you can have, but not everyone can afford it. That's why there's an alternative, Medicare Advantage. That's why that exists. And there's 0 premium plans that encompass everything: your dental, your vision, your hearing, right? And your prescription drugs. So you not only do you no longer have a payment for your Medicare supplement, but you no longer have a payment for your prescription drug plan. So that's a big factor as well. So just make sure that you understand that for sure. And there's no difference between any Medicare supplement and another one. Another really important thing that I know I talk about this all the time, but I want to keep saying it because it's so crucial, is letters to mail to your clients. So I know I sent out, the pre-AEP letter. AEP has been very, very busy. I'm on the phone nonstop all the time, and it's great. It's amazing. And it's the biggest blessing. So I haven't had a lot of time at all to really work on anything in terms of building and reconstructing the website or letters and stuff like that. So just put together some type of letter while I'm doing it. I sent a ton to my assistant to work on, and get those letters that you're mailing to your clients. You could just do something basic. Hey, just so you know, we also offer health insurance, right? The products that you offer, the companies that you offer, kind of like my AEP letter. And you could take that and use that as like a frame of reference and then build something around it. So that's great. And I would recommend doing that and mailing to your existing book of business, dialing your existing book of business, talking to them, door knocking them. Your life clients, you can go sit down with your life client anytime you want to have a cup of coffee, right? It doesn't matter. They're your client. You can go talk with them, and you're allowed to compliantly market other products to your existing book of business, right? That's a question that it literally asks when you're enrolling someone is, how did you get this lead, right? Are they from your book of business? There's a lead, what is it? So your book of business is what you want to be marketing to. So sending out letters to your existing clients, talking to them and trying to get those inbound calls, those are great. And then also going to see your existing clients. That's another thing that's really important. Setting up appointments, you want to do that as well. Another thing is the T65 list. So the whole reason why we buy leads is to build a book of business. It's such an important thing. So you might have bought thousands of leads, maybe tens of thousands, depending on how long you've been in the industry, tens of thousands of leads in your career, right? Thousands of leads. And even if it's just hundreds of leads, you're going to have people that you can market to. And I'm sure you're going to have people that are turning 65. Whether they have, what I run into is people that have already been disabled, right? So they're disabled and they now are turning 65 because they were disabled under the age of 65, but now they're aging into Medicare itself or turning 65, even though they're already on Medicare, right? They're T65ing. So what happens is with these people, they now are still considered new to Medicare. So for a Medicare supplement, they have an open enrollment, right? Which means that there's no underwriting from when they turn 65. So that's great. And the other thing is it's now full comp again when they move from one Medicare Advantage plan to another, right? So if you were to switch them, if they turn 65 in December of this year, right, and they're already on a Medicare Advantage plan, you enroll them, it's now considered a T65, and theoretically, you're supposed to get paid full commission on it. So make sure you're marketing to that as well. I mean, just pulling that list of people that were born, in 1957 by the end of this year and 1958, right? That's going to be a lot, even if it's 10 people, right? 10 times $601 is $6,000 plus the health assessments for an extra $750. Right there, just on 10 people, you make close to $7,000. 10. That's amazing. That's a tremendous amount. But you didn't just make that $7,000 once. Now you're going to have that renewal at $301 for going forward, right? Hopefully in perpetuity for the life of that client. That's an amazing thing. So I want to make sure that you're doing that. And you can just pull this data from the carrier websites. Royal Neighbors doesn't let you pull it. So that's why I always tell people, hey, make sure you're doing these Medicare worksheets. Make sure you're doing these final expense worksheets because they are so incredibly crucial. So that's another thing that's off the list over there. Next, I want to talk about something that is so incredibly important while you're in the field, right? Sometimes we're out in the field and we don't know the answer to something, or we have to find the answer. Maybe we don't have the doctor, and that's an important thing. Now we got to find the doctor, and it was just a nurse practitioner or physician's assistant. That's the name on their prescription bottle. And that's the only person that we can find. And we pull it up in Sunfire and we type it in, and it's saying, hey, this isn't a PCP, because it's not a primary care physician. This is just it's just a PA, physician's assistant, or a nurse practitioner, an NP. So they can't be listed on the card majority of the times, right? 95% of the time they can't be listed on the card. So you have to find the doctor. So that's just something that's being creative, is all that it really is. And it's nothing complex. You just go on Google, and that I found that to be the biggest differentiator between high performers and lower performers is the resourcefulness to get the answers that they need to move at a quick pace to get from one client to the next and do the sale and do it properly, is being incredibly resourceful. I found that to be a very key indicator of someone's success long-term in this business, is how resourceful are they? How can they get the answers that they need to become self-sufficient, right? To do that. It's a great thing to have, my website, to have access to me and all that stuff as well, right? That's a tremendous thing. That's a resource I didn't have, right? It's something I didn't have at all. So I'm grateful to be able to provide that as well, right? But for me, how did I get all of these answers? Well, I went out there and I found the answers, right? I read all the literature that I can read, because I want to be the best of the stuff, because I know if I provide the best service to my client, this benefits me and my family for forever, right? For a very long period of time, this will benefit myself and my family. So being creative and resourceful to get those answers when it comes to the Medicare side is such a crucial thing to make sure that we're doing this stuff and doing it right. Now, what I want to do is I want to go and I want to show you guys something that's really important that I was talking about, but I talk about with a lot of agents actually. And I see this happen all the time. And what it is and it's really, really important for us to do this and look at it. Let me I want to pull up one of the cases here. So I want to look, let me do stop share real quick. The Humana spreadsheet shows $50 payback, but I was told $100. Mike, I don't know what you mean by that. The Humana spreadsheet. I don't know what you're talking about, my man. So just text me. Humana payback, you mean the give back plan? Maurice, I see you unmuted. Do you have a question? Nope. Okay. So, all right. So let me go ahead and pull this up. So I have a whole list of drugs for a client, and I want to just type this stuff in, and I want to do it live with you guys looking at it. I want to show you some mistakes that can be made. Wait, you can't see my screen. So give me 1 second. Let me go back over here, and I'm gonna do this live with you guys so you can see it. So let's go back to Zoom. Let's go share screen and screen 2. All right. So one thing that you're going to see is when you start entering the prescription drugs for the clients, you're going to see that sometimes you're like, wait a second, the prescription drug cost is $16,000 on Sunfire, but when I start to, type it in over here and I'm looking at it, it doesn't say, right? It doesn't say $16,000 over here, right? Like what's going on, right? Why is it so incredibly expensive? And more oftentimes than not, it's because you're typing the information in wrong. So that's a big, big thing as well. So let me give you an example for one of them. So meloxicam, I'm going to type that in, which is a very inexpensive drug. And the way that I always know, meloxicam, good RX, so just literally go, right, resourcefulness. This is a big thing. I look at it, I'm like, oh, okay, well, how much does it cost, right? If I was just to get it at a pharmacy, a CVS, right? How much does that cost? So there you go. It's $17 and change if you get it from a pharmacy. HEB grocery, $4.22, Costco, $4.99. So there you go. Look at the cost of it. It's so incredibly, it's such an inexpensive drug, right? So that's an important thing. So as we're adding these drugs, we need to make sure, and I'm going to show you what we need to make sure of. We need to make sure we're doing it properly. So looking at the bottles and everything is really important. And that's what's going to go ahead and determine the prices of it, because you don't want to make any errors, because it happens all the time with a lot of agents that are out in the field and they're selling. So let's go ahead and put these ones in. Let me see if there's another one that I wanted to add in. I think those are it. All right, so let's go ahead and let's add those drugs in over here. 1 second. Oops. Okay. Okay, so let's see. All right, so over here, as you guys saw, I added in these three drugs, right? And you're like, wait a second, digoxin is so expensive. So I just go Control C, Control V, and then I just, go GoodRx, and I'll just type in the generic name and see, is there a generic? And like, oh, wait a second, the brand name is Lanoxin, so this is a generic drug. Oh, okay. So then my next step is digoxin, GoodRx, right? Just figure it out. Look at it and say, okay, well, how much is this going to cost, this generic drug? $2 and change at Costco, $5, $3. It's like, oh, that's really cheap. Okay, so what's the issue that I'm running into with this, right? It's $13,000 for all these drugs. I go to details here, go to drug cost details. I scroll down. Digoxin's not on the formulary. What? Doesn't even make sense. Meloxicam's not on the formulary. It's a generic drug, right? How does that even make sense? Tizanidine, that one's not on the formulary either. So it's like, or it is on the formulary, but it's showing as a tier 4 drug, which could be the case, right? It could be a tier 4, but I just want to see if it's an expensive drug, right? Is a tier 4, 59 cents, $4? Like, okay, yeah, that's there's got to be something off over here, right? So what I do is I go back over here and I edit it, and then I double check. I make sure I'm looking at the right one. What did I type in here? Okay, capsule. 10 mil. Oh, I probably put capsule and not tablet. It's supposed to be a tablet. How do you know that? You look at the actual pill itself. What is it? Is it a capsule or tablet? Look at the cost. Went down from 13 grand to 2,100 bucks. Right? You're like, oh, okay. I see the difference there now. So you type it in, and you're like, oh, look, it went from not on the formulary to a tier 1 drug, which is free through the mail. Right? So that's a big thing, is just making sure that you're putting the drugs in right. So now the other one that wasn't on the formulary was the digoxin. Okay, so let's get rid of that. I clicked this one first, right? Now I'm going to go to the tablet, 125 mcg, hit save medication, save pharmacy, and let's go back to it and see if that makes a difference at all, because it's a generic drug. I mean, it should be cheap as long as it's on the formulary. Look at that. So we went from initially 13 grand to now $204. With Aetna Freedom PPO, it's 168 bucks. That's a pretty big difference. And then the last one is the tizanidine. And let's put that as so I put that as a capsule. I think I did the first time. Let's go ahead and change that to the tablet. So I'm almost certain this guy was taking a tablet. I could be wrong, could be right. But let's go ahead and let's find out. Now the drugs are $0. So we went from $13,000 in drug cost, right, to $0. That's a very, very big thing. So just make sure you're putting in the right thing. You don't click capsule. You don't click whatever it might be, the liquid. Make sure you're clicking the right, not just dosage, but the type of pill that it is, a capsule or a tablet. So that's very, very important as well. So Lori said she's run into a couple of veterans who have been on full MAPD plans, but still get some of their drugs from the VA. So yeah, I mean, veterans can use an MAPD plan. There's a lot of vets that I see. They're like, I would never go to the VA. I don't go to the VA. Maybe their local one isn't a good plan. And that's okay. That's fine. You know, it's not a good VA by them. They don't like it. And the other one's too far to drive through. Clay and I were talking today, and he's like, the VA that he has by him in New Jersey, he's got like great reviews and they absolutely love it. And it's phenomenal. He says it's the best VA and all the clients love it. So they don't need it. So a vet can get a full MAPD, right? That's fine. Most of the time, if they're getting the drugs from the VA itself, okay, then just MA only plan, right? But if they have zero intention of using the VA at all, like they don't use it at all, but they're a veteran, that's fine. Like they don't have to use it. They can get a full MAPD. So most of the time you'll look at it and you'll just say, okay, well, you know, hey, do you get your drugs from the VA? No, I don't. Okay, so let's go Part B give back. And I just look at it and I say, all right, we could save you $125 per month on your Social Security check as long as you're paying the Part B premium. Okay, so that's important. How do you know if they're paying the Part B premium? Right in the training, you just go to Medicare Parts and Programs, you click it, Medicare Savings Program, and just read that and it'll tell you the dollar amounts. So with that said, all you got to do here is you can see, or you go to Medicare Advantage plans, and then same thing, we're going to check the box for Part B give back. And that's where we're going to go ahead and see if we can save them the most amount of money. So this Humana Honor PPO, two different ones, two different plans. So they're both called Humana Honor PPO, but this one's plan code is H5216-348. This plan code is 25216-128. So that's interesting. But this one is a 125 give back. That's tremendous. $125. So you're sitting down with a veteran that gets their drugs from the VA. They actually use the VA services, but the VA doesn't cover dental for this specific client, right? And they're like, hey, I just want something that covers dental. I got A and B on my Medicare card. I'm paying for it. Oh, okay, great. Well, not only are we going to give you about $1,500 a year, is that right? 1,500, 125 times 12, $1,500 a year, right? But we're also going to be able to give you, click details. You just scroll down here and you look at it. We're going to give you dental service. We're going to give you $1,000 towards dental, right? So that's tremendous with $0 copayments, right? $0 copayments on everything except if it's a Medicare covered benefit. In addition to that, we're going to give you $100 towards eyeglasses, right? You have your inpatient hospitalization, of course, in there, transportation if you need transportation. And you just kind of go, just like normal, you go through the benefits. You're going to have your OTC, $50 every single month, every single quarter. So every 3 months, that's another $200 that you're putting in someone's pocket. So not only are we giving you $1,500, we're going to give you an extra $200 here. We're going to save you $1,000 on dental. right? Then we're going to save you an additional $100 towards eyeglasses with a free eye exam, basically. Let's see. And then the next question, when a prescription is not in the formulary, can you always, yeah. So if a prescription is not on the formulary, one, double check everything that we just did, we want to make sure we're doing it right. And then the other thing is the doctor can request a formulary exception. So it's got nothing to do with us. We don't do anything. You just tell your client, hey, this drug's not listed with this company. Obviously, you want to find a company that covers it if possible, but sometimes drugs aren't on there. And if the drug's not on there, it's not listed, they have to pay full price for it, right? If your insurance doesn't cover something, you got to pay for it. If you want Botox, right, you got to pay for it, right? Does the insurance cover it? No. So you got to, unless they have cancer, that's the only exception to that rule. But with that said, they can request what's called a formulary exception for the prescription drugs. So if there's a drug that's not listed on it, they can request it. The insurance company can approve or deny it. So more often than not, just find a plan that covers it for the prescription drugs. So if we go down to the bottom, this Humana Choice PPO, that is $1,300 because it's got a premium as well. And it has these drugs as tier 1 and tier 2, but the co-payments on this is going to be a lot more expensive. So $16 a month. And let's see if the client hits the donut hole. They don't. Okay. So they're paying $16 a month plus a $93 a month premium. Right. And you're still going to run into these all the time. You're going to run into people that are paying premiums that they just literally have not updated it because they got health insurance. The health insurance works. You know, they don't feel like they need to change anything or do anything different. Right. So that's a very important thing as well is, hey, you know, like I'm looking at this stuff and you sit down with someone and you're looking at their cards and then all of a sudden you like start looking at it. You're like, wait a second. Humana Choice H5216-042 PPO, and you see that in the bottom right-hand corner or left-hand corner of their card, and you're reading, you're like, no way, this person's paying $93 a month. Does Humana happen to have any PPOs that are $0 premium? Right? Yeah, they do. Right? Here's one with $10. That would save them $83. Here's one with 0 premium with the $75 per month Part B premium give back. Right. So let's take 93 plus 75. Their social security check is going to go up by $168 a month. I think that person's going to love you. So I have this life insurance client of mine whose husband is a vet. Okay. And he goes to the VA for pretty much everything. And he's as healthy as can be. So he doesn't even really go to the doctor. And he has now this coming year, he's going to have $125 gift because she called me about her insurance. She's like, it's really expensive. I don't know if we can, afford it. And I don't know if we can keep it. And I look it up, pull up the case, and they're paying $147 a month. Say, okay, great. Pull up her case. I look at it. I'm trying to see, does she have her health insurance with me? Yes, she does. What plan does she have? Oh, she's got UHC plan. Okay. I look at her area. I see, okay, well, for her, and let's see, does her husband have his health insurance with me? He does. Well, they're both in United Healthcare in their specific area. In that specific area, there's no give back plan. So I'm putting $125 back on his social security check. And then I go for hers and I get her $75 back on her social security check, right? Because they're paying the Part B premium. So now I'm giving them basically $200 a month. Their life insurance premium payments is $147. And she was wavering on if she can afford it or not, right? If it comes down between food and paying for your bills, your life insurance bills, then sometimes people just cancel it. So now she's looking at it, she's like, oh, okay, well, that makes sense. Yeah, I think we can swing that. It's going to be pretty easy. And in fact, now they're going to be making more money with the difference between the $200 and the $147. Now they're still up positive $53 after their life insurance cost. A Part B give back plan isn't always the best option for a client, right? It's based on drugs and it's based on all this stuff. Otherwise, my entire book of business would be in a Part B premium give back plan. It's just a great alternative for those that are relatively healthy and the math makes sense, right? What do you mean the math makes sense? We'll take the number, multiply it by 12 and ask them about their healthcare. Hey, put their drugs in. How often do you go see the doctor? How often do you go see a specialist? It's $75 give back right here. So right now, let's say, for example, that they're only paying $20 for a primary or a specialist, and it's $40 with this. Let's say they're paying $0 for the primary, and it is $10 with this. So if a client goes to see their primary doctor twice in a month, okay, and they go see a specialist twice in a month, they're paying about $60 additional cost. PCP, they were paying 0. So now they're paying 10, 2 visits is $20. They were paying 20 for a specialist. Now they're paying 40. So it's a $20 difference with 2 visits. That's $40. So 40 plus the 20, that's $60 difference. So it still makes sense. They're still positive $75 minus the increase in doctor costs, right? They're still positive $15. So it just becomes a math problem. Like, hey, what's the frequency that you go? And does this make sense for you? Right. And if it doesn't make sense, we're not going to put them in that plan. This one just happens to be a very strong give back plan in this area in Texas. Right. But every area is going to be different. So that's something to be aware of as well, as you just simply just look at the numbers and just say, hey, that's all that it is. Like, you take out your pen and pad and you start writing it down on your in Notability, and you start writing it down, and you write out, hey, your PCP now is $0, PC or specialist is $20. Now here's the difference. And you just write it out and just show them. Right. And you also look at the other things, just literally read through the stuff. It's all alphabetical. All you got to do is just go back and compare them between the two, and just kind of see in terms of like a comparison. And then you just look at them and see, this one's got $3,000 in dental and it's got $75 give back. This one's got $2,000 in dental with no give back. Right. Okay, great. What's next? This one is 0 to go to the primary. This one's 35. This one's 10 to go to primary. This one's 40. Well, if you ever run into anyone in this territory in Dallas and they're on this PPO plan and they are paying the Part B premium, this one is unbelievably better, right? So you got to look at all those factors and just kind of compile them, and then now it's an educated decision. Here's the major difference here. We can see is a $320 one extra day per day for 6 days. And this one's $290 per day for 5 days. But they're still saving $900 per year with the Part B premium give back. Okay. So with this, yeah, it's an extra $30 per day for the first 5 days. That's $180 or $150 plus an additional day at $320. So it's $470. Okay. So $470, they're still saving $900 minus the $470, right? So it just becomes a math problem. You're walking them through it, right? So that's a big question that I get a lot from clients. Well, how much does an X-ray cost? How much is a CT scan or an MRI, right? I don't know. Summary benefits, evidence of coverage, just Control F and just search for it to see the differences in there and kind of look at that stuff. So those are some big factors. Now you just saved them $75 a month, right? And this inpatient hospitalization cost goes up. What about a hospital indemnity plan? Are you pitching hospital indemnity? Right? Are you selling hospital indemnity? Are you on here and you watching Hospital Indemnity Explained? Are you going to GTL's website, downloading all that information? I know I sent out the guides before in the past in an email too, but you download it directly from the carrier's website. Like, what is it? How does it operate? What is a hospital indemnity? Are you pitching those with your clients? And it's fine if you got to move fast now to get from one client to the next, right? During AEP. And then after AEP, you go back and you revisit them again and say, oh, hey, I know I told you, I talked to you about the hospital indemnity plan. It gives you a reason to go back. Another opportunity to sit with them, for them to see your smiling face. That's a great thing to do. And now you can get a potential sale out of there. Even if out of 10 clients that you had during AEP, you sit with them again, you only get 2 sales, right? For hospital indemnity plans at $40, $50. That's money that you would not have made, right? If you didn't talk to them about it. About 90% of clients don't have hospital indemnity plans. So there's one injection. Yeah. So that's a good question by Chris. Yeah. So this was something that she ran into, is someone that had an injection that they have to get monthly at the hospital. So it's very expensive, very costly for them. And, but you can't look it up as a prescription. That's because it's not a prescription. It's not a prescription drug. So a prescription drug is what we call something that is self-administered. You give it to yourself. You take the pill when you're home, so they call that a self-administered drug. This is a shot that they're getting in an outpatient hospital setting, outpatient, and the doctor is charging them or billing the insurance company for the cost of this and then charging them the difference. So there's a lot of nuances of Medicare that you can't encapsulate in a training at all, right? And no one person has all the answers for anything either. So a couple different things that I do is I always tell you guys on every call, it's like, hey, make sure you are reaching out to your local rep. You're talking to your local rep. For me, I tell you guys all the time, it's like, hey, I got letters and stamps to send out all the time to clients. All I have my rep do is just send me out. I just tell them, hey, I need to send 300 letters out to clients that are turning 65, or my existing book of business. I need to send 300 letters out to my existing United Healthcare clients. And can you send me 300 stamps? Yeah, no problem. Just literally mails me out 300 stamps. So one thing that I do is and the reason why I'm saying this is because they are a valuable resource. So you want to ask them specifically, hey, can you kind of help me with this and figure out what would the cost be with United Healthcare? Here's the name of the drug itself, right? It's not a prescription. It's not a self-administered drug. So I can't look it up using, UHC Jarvis. I can't look it up using Sunfire, right? So, what is this and what is it all about? So that's a good thing. That's a good question for your local rep. It's a good question for the doctor's office. And it's a good question for the insurance company directly for special things like that, like an injection at a doctor's office. You're not going to find in the evidence of coverage, right? So summary benefits is short, evidence of coverage is long. So evidence of coverage, if you type in injection, here we go. Okay, so collateral factors that you give yourself. Medicare, oh, this is chemotherapy. Okay, well, that's fine. So Medicare Part B prescription drugs. Okay, so injectable osteoporosis drugs, if you are homebound, have a bone fracture that a doctor certifies was related. Okay, got it. And then it says over here, chemotherapy drugs, 20% coinsurance, Medicare Part B covered drugs, 20% coinsurance, and at a network Part B, 20%, and then chemotherapy coinsurance, 40%. So to give you a little breakdown there. So if you just search for injection and only one thing comes up, yeah, you're probably not going to be able to get the answer that you need just by looking at the evidence of coverage or the summary of benefits on the website itself. That's okay. It is what it is. We're not going to be able to find the answer for that. So we have to use those other resources to try and get an answer for how much this is going to cost. Sometimes you call the doctor's office and there's like, I don't know, I got to bill the insurance company first and then we'll figure it out later. That's not a great answer, right? It's not an answer that I like, but that's why I bring it to the local rep and I bring it to the insurance company to really figure out how much this is going to be. So that's something that you got to go above and beyond. Sometimes, right, if a client's in a plan and it's working for them and it's a very, very complex situation, they're dying of cancer, right? I'm not going to flip their health insurance, right? I'm not going to change it from one plan to another if they're on hospice care and they're dying. I'm not changing anything. They don't have the wherewithal to go through changing meds or doctors not taking any insurance or stuff, whatever it might be. So those are the complexities that we might not be able to get an answer with a client immediately. And you just got to tell them, hey, I'm going to do my research. I'm going to get a little bit more information and then we'll just go from there. So that's a big thing for us as well. So what other questions? Let me just see if I had any other questions. Hold on. All right. Does anyone else have any other? Oh, here's another one. Okay. Part A only or Part B only? Another question that I'll get is, hey, can we, sell something to someone that only has Part A or only has Part B? Well, the answer is no. You can't. You can't sell anything to someone that does not have both A and B. You can't sell them a Medicare Advantage plan. You can't sell them Medicare Supplement. The only thing that you could sell them is a PDP, as a prescription drug plan. More than likely, the reason why someone doesn't have Part B is that because they didn't want to pay the $170.10 a month. I get it. But if you don't have it, you can't get health insurance. Not my rules. I don't make the rules. It's the government, right? It's not confusing. It's not complex. Straightforward. If you don't have A and B, you can't get a Medicare Supplement. You can't get a Medicare Advantage plan. It's that simple. And you can offer them a PDP, hey, it's $8 a month, but they're also going to have a penalty because if they don't have Part A or Part B, right, they more than likely don't have it because it costs money. And since they don't have that because it costs money, they also more than likely never enrolled in a Part D, a prescription drug plan. Therefore, there's going to be a penalty for the client not having it. So keep that in mind. And that's a very, very, very big factor for us as well to make sure that you guys understand is Hey, sometimes we got to walk. We're not gonna be able to help everyone, right? It's like, hey, this client's in a good plan, right? What can I do? We go through everything, we look at it. It's, hey, they're in a great plan. They're in a great situation. We're not going to be able to change everyone. We're not going to be able to help everyone. And that's okay, right? We're going to do our best to try and help put people in the best situations that we possibly can. Jeremy asked, if someone is on a UHC dual complete plan, what's the best option to pitch? That changes by county. So I would need the county, I'd need the zip code, and I need to look it up, whatever the city, state, and county is. And then I just look at the other options in there and I see if there's something that's available. Are they on a PPO? Are they on an HMO? Is Humana in that area that they can use the card, their OTC card, towards rent? So OTC, food, utilities, and rent, is it a greater dollar amount? Right. So I look at the other factors. Just literally everything that I just did here in Sunfire, I do the same exact thing. Right. So I just go to special needs. I look at the different plan options, all the stuff that we just did right here. I hit compare. I look through it. I look at the summary benefits for each plan. I look at, I don't know if theirs comes up under food. Look at healthy food allowance, $100 per month. Okay, so they get that. The next thing, Cigna Medicare Advantage incentive, you can earn money for completing healthy checkups. After completing your yearly health checkup, you can qualify for additional incentives. You can earn up to $100 loaded on a card. That's great for doing those things. Cigna Healthy Today card, which is your healthy groceries, that's $100 a month that they get on there. So that's really awesome. Utilities allowance is $75 a month. So I just look at the benefits of each plan. I go through it and I just do a comparison and see which one is the best option, if there's something that's better for them. And at the end of the day, we just have to pitch people. And the more that you pitch clients, the more sales that you're inherently going to get. Right. So that's it. And sometimes someone's in a great plan and you simply just can't help everyone. And that's okay. There's nothing wrong with that. We just got to get to the next person and we got to take note. Hey, this person's in this plan. And then you have that in your CRM, and you get back in touch with them, or maybe they're already your client on the life side, but you talk to them, you reach out to them, and you just can't help them. So the pitch would just be looking at, what other plans are in the area and reviewing them and seeing if there's something that makes sense. And in the end of the day, just pitch it to the client and see which one makes the most sense. This is a 5-star plan in my area for Cigna. So that's pretty dang cool that they got a 5-star. So you can enroll all year round there. So cool. All right. Let's see. So let's see. Ran into a guy without Part B for 2.5 years. So once he gets enrolled on a Part B give back, may work for him to help offset his penalty, maybe as a yeah, definitely. Yeah. So Jeff just wrote in there, ran into a guy without Part B, and he hasn't had it for 2.5 years. So this guy's going to have quite the penalty, and he's going to owe Medicare. It's going to owe Social Security, so you have to pay it to. He's going to owe them a lot of money for not having it. So it's more than likely you're going to end up owing them. So initially, when someone first enrolls, they got to pay $510 unless it's coming out of their Social Security check. Then it's $170 per month. So 170 times 3 is 510. So they got to pay it quarterly, and then they can have it set up to their account. So this guy is probably going to owe them some money in addition to having a penalty, right? So you just got to kind of see like, hey, he's got to call Social Security and he's got to figure that out himself. Now you can sit down with him and try and do it if that's your first appointment of the day. Social Security sometimes can have really long hold times. You can go on SSA.gov and create an account, see if you can look it up there. But yeah, so hey, once this guy gets enrolled in this plan in Part B, and now you can sell a Medicare Advantage plan, you could put him in a Part B give back plan. So that's a huge thing for him because that's a big incentive for him to get enrolled in that plan. And Jeremy said that we can't see your screen, but yeah, I mean, so you guys get the point on how to search through it though in Sunfire. Just look at the summary benefits and Control F and go through it. It's the same process, Jeremy, as every single plan. There's no difference when pitching it. It's just looking at the different benefits and just going over it, right? You're a salesperson, so just kind of Just pitch it. That's all you got to do. Just look at them. Hey, this one gives $100 per month towards utilities and $100 towards food. That's 200. This other plan only gives 150, right? It's like, which one makes the most sense for you? And I always look at it from my perspective too, right? Which one would I want to be in? You know, what makes the most sense? Sometimes people have this card. It could be $150 for utilities, food, and over the counter, right? But their utility bill is included in the rent. Whereas the rent one with Humana might only be $100. Yeah, it's $50 less per month, but their utilities are included in the rent. So they can't just pay the utility bill with that. They have to use it and use it to pay towards rent. So that's just being creative, asking your clients questions. So just making sure that you ask the clients the right questions. Hey, do you pay rent? You do? Okay. Who do you pay it to? Do you pay it to a landlord? No, I pay it to my daughter, or I take cash out and send it. Oh, well, obviously you're not gonna be able to use a prepaid debit card to pay it. It's got to be paid towards a landlord. And if you have more questions like about specific things like that, that's why you establish a relationship with your local rep. They know the ins and out of that market. This is what they do. They're literally on salary to do it. Okay, so that's their job. Cool. All right. So does anyone else have any other questions there? If not, we will hop off. Okay. Well, I appreciate everyone for joining. Thank you so much, everyone. If you guys need anything, just reach out to me. We'll keep on rocking here. So y'all are doing a phenomenal job with AAPs. A ton of apps coming in. Just keep on going. If you got questions, reach out to me. Text, phone call, email. If it's not as urgent, you know, and you're not with the client, just text me and we can kind of schedule a time. Or a lot of you guys send me emails with cases if you're not with the client, right? Depends on the sense of urgency. Just let me know. I'm always available. I want to help you. But there's a sense of urgency, right? If I'm on the phone with someone else and you're with a client and they're not, I'm going to hang up and I'm going to get on the phone with the person that's on the phone with the client. So awesome. I appreciate everyone. Have a great evening and I'll be talking to you all soon.